Hi, my name is Brian Muthyala, and I'm the program director for the transitional year residency at Hennepin Healthcare. I'm excited to talk to you briefly today about some of the logistics and the details of the TY program and the TY year. I'll talk a little bit about the details of intern year, but also sort of my approach to running a residency program. And I think the TY year at Hennepin can be a really special one. The transitional year program has a long-standing partnership with the University of Minnesota. And as of a few years ago, all of our residents in the TY year come from categorical programs at the University of Minnesota. So radiology, interventional radiology, radiation oncology, anesthesia, and ophthalmology are all residents from the University of Minnesota who come to Hennepin for their intern year. Our hope as a program is that the TY year is a great place to grow and to learn as a trainee, build skills and confidence in yourself as a clinician. But in addition, our hope is that after the year, that every one of the TY residents has really built trust within themselves and has built the ability to build healthy relationships with themselves, with their patients, and with their colleagues. The hope is that residents are coming from Hennepin and they are going to their categorical programs with confidence in themselves as clinicians. Having spent a year working hard, caring for patients in multiple clinical environments will only make you better in terms of the work that you're ultimately going to be doing. And our hope is that the TY program here at Hennepin can be a real rich learning environment where you can cultivate a whole host of skills that you'll take with you for the duration of your training period. For just really briefly, HCMC is in downtown Minneapolis, just a mile or two from the University of Minnesota. It's a safety net hospital, so we have a very high number of underinsured and underserved patients here in Hennepin County in Minneapolis. Additionally, we're a Trauma One hospital, so we care for patients across the entire state and region with our sort of trauma mission, of which transitional year residents will be a part of when they're in the emergency department on working alongside the surgeons and the surgery teams. This is an immersion year where you will get to know Hennepin really well. You'll get to know all of the different specialties within your own sort of categorical programs, radiology and ophthalmology and anesthesia, but also in all of the areas in which you'll be working in, psychiatry units, the OB units. Our transitional year is one of the oldest and longest in the country. We train about 25 interns every year. And we have had transitional year residents at Hennepin for the last 40 years. And because of that, we have a long history of knowing how to work with transitional year residents really well to make sure that resident work is sort of right size for the transitional year experience. So I'm going to go through just a few quick details about the program. I'll talk through some of the key players that you'll know and be working with while you're here at Hennepin for the year. And then I'll also talk a little bit about kind of some schedules and things to just think about as you enter the year. So I have been the program director for a little less than a year. This is my first year as a program director, but I'm very, very fortunate to have a really strong team of faculty and staff that know the program and have been part of this program for quite a while. So Dr. Matt Young is one of the associate program directors. He was a prior program director for the last 10 years. I would say he has uh, built a lot of the foundational things that I'll be talking about today and the things that most of the TY residents will experience during their time here at Hennepin. And he has been very gracious to continue along working with me and the rest of the team um, because he loves the program and he loves working with the TY residents. And so you will meet Matt. Dr. Samantha Pace is the other associate program director. She is an OBGYN here at Hennepin. She has been the TY associate program director for several years. We were med school classmates. Is a wonderful, caring, remarkable clinician, educator, and overall thoughtful person. We have an interim program coordinator right now, Katie Dolan. Katie is a very experienced program coordinator. She was the TY program coordinator a few years ago, is stepping in right now, and is just a great person in contact, has a robust knowledge of Hennepin as an institution, and works really hard to ensure that the TY residents are having a really good experience. And while you may not be working a ton in the radiology department at Hennepin, it's just good to know sort of some of the radiology people here at Hennepin. So Scott Boki is sort of the contact point person in the radiology department and is a great physician, radiologist, clinician in person. And then Dr. Gopal Punjabi is the chair of the radiology department and is sort of a remarkable clinician and really an institution of his own here at Hennepin, and he has a great Twitter or X account. So as I said, we are a large program. So we have 25 interns a year, 5 ophthalmology residents, 10 anesthesia residents, 8 diagnostic radiology residents, 2 interventional radiology, and then 1 to do radiation oncology residents a year. As I said, the TY program has existed at Hennepin for a really long time. And the hope and the goal is that these 25-ish or so people are part of your cohort for the intern year. And then you will go to the U pretty much together and you will continue to work together in your respective areas. And so our real goal and desire is that the TY residents at Hennepin find a home with each other and in a home here at Hennepin for the year that you are here. The TYs work really hard and they have a lot of fun too. We host a monthly dedicated conference that is both sort of about community building, learning, and fun. It's an opportunity to be together, have a meal, talk about your shared experiences. We have a curriculum that is meant to be broad and useful for any specialty that's specific to Hennepin and the community that we serve. So we really focus on sort of larger, broader sort of themes and concepts from trauma-informed care to structural racism. We have sessions on financial planning, and then we have some fun sessions too, where we get together and just spend time with each other. We have a dedicated ultrasound curriculum that all of our residents will go through as well. And it's really an opportunity, really for community building that we really hope to instill in the year. Just if you aren't familiar with Hennepin Healthcare as sort of a teaching site, we have a lot of trainings. So Hennepin alone has around 15 sort of residency programs, fellowships. There are about 250 residents or fellows that are primarily Hennepin residents and fellows. But we're also the largest site for many of the University of Minnesota residents and medical students to also go to. So at on any day, we can have 400 medical trainees at Hennepin in every department, clinical team. And that's separate from the countless of sort of trainees in all the other medical professions, nursing, physician assistant, dentistry, You name it, there are trainees here at Hennepin, and because of that, the faculty are really used to working with very different kinds of learners. So the faculty are really good, again, at sort of understanding the needs of individual trainees and working closely with individual trainees, regardless of their background, to ensure that they're able to do a good job taking care of patients and to ensure that they're learning. Just really briefly, I'll talk you through some of the different schedules based on your categorical program. So the diagnostic radiology schedule is really focused around a core set of rotations that is pretty consistent with transitional year programs across the country. So residents or diagnostic radiology residents will spend 2 months in the emergency department, 2 months in surgery. You'll spend 2 months in radiology, some at the U, some at Hennepin. You'll spend time in pediatrics, neurology, where you'll be looking at a lot of scans, OB, psychiatry, and then every resident in the TY program has sort of a flex block in which they help out with some of the coverage for TY residents, as well as can do a quality improvement project and potentially research depending on their sort of interests. If you're an interventional radiology resident, you're going to spend, again, your sort of foundational clinical blocks are emergency medicine, inpatient internal medicine. You'll spend time in the MICU. You'll spend 2 months of surgery that is generally split between general trauma call and then a surgical subspecialty like vascular surgery. You will have a block of pediatrics where you'll spend time on the inpatient pediatric wards and the PICU. You have a block of inpatient psychiatry, and then you have a one quality improvement group. I'm sorry, quality improvement elective. For radiation oncology residents, again, the schedule's pretty similar. Again, you'll have one block of emergency medicine, you have inpatient general medicine, you have general trauma surgery. You'll spend 2 months on that. At least one of those surgery months will be cancer related. Again, you have two medical medicine electives, our flex coverage month. And again, you're sort of spread out through the hospital again to get a really broad exposure to all the different areas that you may be helping out with during your categorical years. And then just some general information. So while transitional year happens at Hennepin, all the transitional year residents are employed through the University of Minnesota. Currently, the University of Minnesota and the HCMC, the Hennepin County residents, are going through a unionization process. All of those are ongoing right now, the negotiations and things, but transitional year residents are employed through the University of Minnesota and will be part of the University of Minnesota Resident Union. Orientation begins typically the second week of June, and you will start on the wards 2 weeks later. As of right now, you have 2 weeks of flexible vacation, and then you have a third week of vacation right before you start your second year at the university. There is a free workout room with like a Peloton and a treadmill that residents utilize. There's free parking here at Hennepin. You have a food budget that you can use at our cafeteria. And our cafeteria, if you haven't been here, is rated as probably the best hospital cafeteria food in at least the area, the metro area. They are always having like competitions, and there's a wide variety of food for different types of diets. So residents feel pretty happy about the food options while they're here. And then all of the transitional year residents have access to our RISE program, which is a Hennepin County specific sort of place where residents can get physical and mental health support. It's like a one-stop shop. You send a message to a line, and it's somebody whose job is to connect with residents and trainees to provide with them support. It's free, I'm sorry, it's anonymous. It's really flexible. Our residents take great use of it. There may be some subject to out of network or out of pocket costs because it's a Hennepin program and you're a University of Minnesota residents. We have sort of all the details of how that all works for you all. But it's a program that our residents find extremely valuable and very, very accessible. You know, our real hope is that residency in general is meant to be rigorous. It's meant to push you. It's meant to be a time in which you will grow, but it's also can be fun. Our hope is that the TY year is a year in which you can thrive, where you can find joy in the practice of medicine, where you can really build your professional identities as a clinician, as a physician for the first time after graduating from medical school. And we really believe that we have here at Hennepin something really unique, which is a close-knit learning environment that all of our residents can succeed in, which is, I think, the reason that drew me to wanting to be a part of this program in the first place. This is my contact information. Please, if there are any questions, I'm more than happy to answer them. Don't hesitate to reach out. And thank you, and good luck. Take care.